The ongoing vaccination drive in Guyana against the coronavirus, which began in February, has since seen 100,000 people accessing the jabs, a monumental achievement according to the government, who had hoped to achieve this number by the end of April. Commencing with the vaccination of frontline healthcare workers, the vaccines quickly became accessible to the elderly and over 40 populations, and as of April 16, persons 18 years and older became eligible. But while the response to the vaccine in Guyana thus far has been positive, there are still persons who are refusing to access the vaccines, questioning its efficacy. As such, and in an effort to clarify the common myths and misconceptions of the COVID-19 vaccine among the young Guyanese population, the Guyana National Youth Council on Wednesday hosted a virtual panel discussion on vaccines and youth. The panel discussion served as part of the Pan-American Health Organization 19th Annual Vaccination Week in the Americas under the theme Vaccines Bring Us Closer, #GetVax. Present on the panel was Dr. Guyanese Sankar, an award-winning Guyanese scientist who spoke extensively on the importance of the Guyanese population accessing the life-saving jabs. It was highlighted that one of the major myths is that it is not necessary for a person who has a healthy immune system to access the vaccine. However, it was stated that while the immune system is programmed to fight diseases, it is not quite as efficient in fighting the coronavirus.
However, if you get COVID-19, your risk of becoming severely ill, having to go to a hospital and be on a ventilator and dying is actually quite high compared to any sort of risk that is associated with getting a vaccine. And so that's why it's extremely important, if you have access to an approved, reliable vaccine, that you get it.
Although the world has seen a high recovery rate from persons who were infected, Dr. Sankar reminded that this does not mean complete immunity.
But the thing is, we don't know how long your immunity will last. And so right now, what we're having a vaccine will actually help to boost your immunity further, number one. But then number two, we also have variants, and the variants around are the variants of concern in particular.
Based on scientific studies, she stated that the vaccines have been found to be effective against these variants. According to Dr. Sankar, while there is no guarantee that being vaccinated will prevent a person from becoming infected, it is still wise to access the jab despite this shortcoming.
You may be able to still transmit to other people, which means that for you now, you have to still mask, keep your distance, wash your hands, and all those public health measures. But if you yourself are ever infected while you are vaccinated, you will now, of course, just most likely just have mild to moderate symptoms.
At present, Guyana has received a total of 265,000 doses of COVID-19 vaccines, having recently received 83,000 doses of the Russian Sputnik V vaccine. Earlier, 3,000 AstraZeneca vaccines were received from Barbados after the country received a donation from India. 20,000 Sinopharm doses were received as a donation from China. A further 80,000 AstraZeneca vaccines were received from India, 55,000 Sputnik V vaccines were received in 2 shipments, and 24,000 AstraZeneca vaccines were also received through the COVAX facility. For the HEP Nightly News, Kendell Richmond.